Thank you. I have a question for you on behalf of Michal Bonstein, which is the head of the Israeli Midwives Association. And she's interested to know what you think of the third stage in birth regarding the right timing for clamping the baby's umbilical cord, if at all, and regarding the release of the placenta, the birth of the placenta.
Mm-hmm. So, as usual, it's always fruitful to start from the physiological perspective. You know, once more, when some event like that have been highly disturbed for thousands of years by beliefs and rituals, all sorts of cultural interferences, we have to start from what we can learn from physiologists, particularly when we talk about the third stage of labor. That has been dramatically disturbed for thousands of years. Since in most cultures, they have routinely separated mother and newborn baby. That with beliefs such as the colostrum is harmful for the baby, so you must separate mother and newborn baby. You need a ritual to rush to cut the cord. So that to understand this phase, we cannot rely on any cultural model. All societies have dramatically disturbed this short period of time. So let's start from physiology. We understand today that immediately after birth, during the first minute following birth, the mother, the human mother, has the capacity to release the highest possible peak of oxitocin she can release during her whole life. Peak higher than for the birth itself, higher than during an orgasm, higher than during a milk ejection reflex, higher than during any other situation. The mother can do that, and that's a vital peak of oxytocin, necessary for a safe, bloodless delivery of the placenta, plus oxytocin, love hormone. So what we can understand today is that this peak of oxytocin can be released only in a certain environment. Oxytocin release is always highly dependent on environmental factors. It's a general rule. So, what are the main conditions that make possible this high peak of oxytocin, that make easy the birth of the placenta? First, mother must not be cold. That will be an obsession. At the very time when baby arrives, that the mother must not be cold. That's an obsession. We think of that for the baby, but not for the mother. So that's first condition. Having an electric radiator at home, one blanket, so on. Think of that first. And the second condition is the mother is not distracted. Nothing else to do than to feel the contact with the baby's skin, to look at the baby's eyes, to smell the odor of the baby without any distraction. And that's the point. As soon as the baby is born, there is always somebody who wants to do something. What all societies have done, distracting the mother at that time. And a good example among hundreds of distracting the mother to cut the cord. Imagine a mother welcoming her newborn baby. She's still on another planet after giving birth. Neocortex at rest, another planet, forgetting everything. And forgetting the rest of the world, discovering her baby. And somebody comes, 2 clamps, a pair of scissors to cut the cord. She will look at what they are doing. She will come back to her planet. She will not release her vital peak of oxytocin. So cutting the cord before the delivery of the placenta has many effects. But one of them is to distract the mother and to make more difficult the release of this vital peak of oxytocin. So that's why because it's not overnight that we can accept skin-to-skin contact without any distraction between mother and newborn baby. Such a need for activity when baby is born. Meanwhile, perhaps at the present time, and particularly in developing worlds, it's better to give to women giving birth at the very time when baby is born, to give a drug to facilitate the delivery of the placenta, to contract the uterus more effectively, and to facilitate the delivery of the placenta. It's easy to learn how to give a drug to the woman giving birth, but to help people realize that the newborn baby needs its mother and the mother needs the newborn baby, that will take decades to understand that. No? So we have to be gradual. We have to think of, particularly in developing countries, where they have cheap drugs like misoprostol, you can give per mouth, no need for fridge. So it's a topic at the level of the planet. Facilitating delivery of the placenta with drugs at the present time is the only way to reduce the rate of maternal death, particularly in developing countries. That's only advantageous if we think long term. If we think short term, if we think long term and in terms of civilization, if we increase our horizon, that's another matter. It means that at a global level today, we routinely block the release of this high peak of love hormone women can release just after the birth of the baby. So once more I want to repeat that at the level of the planet we are making love hormones useless in critical periods. So if we think long term, if we think of civilization, that's becoming serious. That perhaps, I think that perhaps this is one of the most important questions humanity has to face at the present time. It is that we have made, at a global level, we have made love hormones useless in the critical period surrounding birth. What will happen after 2, 3, 4, 5 generations if we go in that way? What will happen in terms of civilization? I cannot imagine at the present time a more important question that humanity has to raise. Now we have not to think of the survival of this human group or that human group, the survival of humanity. So it means, to conclude, that the topics we are discussing should not be topics for experts, for midwives, for doctors, for pregnant women. These should be topics for all those interested in the future of humanity.